In many kinds of arthritis, progressive joint deterioration occurs, and the smooth cushioning cartilage in joints is gradually lost. This is evident in ankle arthritis, where the bones rub and wear against each other. Dr. Benjamin Wehrli of Desert Regional Medical Center tells us that when this occurs, it can be painful and difficult for the patient to walk.
A fair amount of people have ankle pain, and for a myriad of different reasons, but it could be associated with an injury, an ankle fracture, recurrent ankle sprains, which is probably one of the more common injuries that we deal with, and that is out there and is seen in the emergency department. Or it can just be rheumatoid arthritis. It could be, autonomic or immune causes of it, of systemic arthritis. But it's pretty common. Typically, it starts in the ankle joint, can be pretty localized. As it progresses, you may get some referred pain. The other thing that might happen is you can have an antalgic gait. So because your ankle hurts, subconsciously you can walk different to compensate for it. So you can get pain and stiffness elsewhere that's associated with your body trying to compensate for the pain in the ankle. Most arthritis in the ankle is probably more systemic or an aging process like osteoarthritis. That's a lot more common than what we call post-traumatic arthritis. And that's either from recurrent ankle injuries like sprains, high ankle sprains, or it's from fractures. And depending on the severity of it, if it's not too bad but you're just starting to notice it, you can do anti-inflammatories over the counter. You can do some stretching and range of motion exercises, make sure it's not, stiffness. You can alter your activity level. So if you have an ankle flare-up that you're not quite sure what it is, just kind of decrease your activity, do anti-inflammatories, ice, elevate, all the good things that we do when we injure ourselves. If it gets to the point that it's really debilitating and you're unable to do things, obviously you should seek, a professional opinion and have them look at it. Make sure it's not any kind of infection or trauma or injury.
Patients need to see their doctor early before the pain gets worse.
If I can see individuals earlier, before they get to the point that they have a lot of pain in there, there's things that we can do preventatively with like orthotics. If it's a mechanical access problem to where they're not aligned right, there's orthotics that we can do to kind of help align that. If it's early on, there's things that we can do through a scope to clean up extra pieces of bone or scar tissue or things like that. Even do what we call microfracture. If you have a cartilage deficit and it's not large, we can go in there and poke holes in the bone and allow fibrocartilage to form in there. So there's a lot of things that we can do early on to prevent some of the end-stage procedures down the road. If you get to the point to where you're looking at an ankle replacement, it's a procedure that has still options afterwards. Ankle fusion is pretty much the end-all. An ankle replacement will allow us to still have motion in the ankle. That's very good tried and true procedures out there and implants that we now have. And the good thing about that is it allows you to have a lot less pain or pain-free range of motion, and you will decrease the chances of getting arthritis in adjacent joints. We're starting to see a trend more to replacements than fusions because of the literature shows that about 10 to 15 years there's a 92-95% survival rate, which is comparable to hips and knees. So it's a very good alternative.